so, for years I suffered from horrible pain in both of my knees. I was like the bones, they're like bone on bone. And I was like a 9 out of 10, I guess is what they call it. 8 out of 10 in my right knee. The left is worse. And, I tried to play tennis. I'm an avid tennis guy. And I mean, it was just wrecking my life. So I went to an orthopedic guy and he said, Jimmy, you got to get surgery on both knees. Bilateral, double knees, or whatever, I don't know what, he called it something, but basically it boiled down to me, both knees whacked. So I was flipped out because I'm only 48 years old and now I've got to have bionic knees put in my body. It was weird. So all of a sudden, one of my friends told me about amniotic fluid injections. And I thought, well, okay, I heard a little bit about this, but not much. But I thought, I don't want the surgery, so I'll give it a try. And, I can't even believe it. I got injected. It took like 3 minutes. I couldn't believe it. I thought it was going to hurt. I'm terrified of needles. I didn't even feel it. I didn't even know they did it, actually. And this was 13 months ago. And I haven't had pain, not 1 minute, for 13 months. In fact, the very next day after having the injections, I still can't even believe it's true. I didn't have any pain in either knee. It's been that way every day for a year and a month. So it's changed my whole life. I'm actually back on the tennis court and I'm excited about things. I can do things with my wife and my family. And I don't know, man, the injection saved my life. Oh, by the way, the surgery's gone. I don't have to do it. My knees are perfect now.
Hi, I'm talking to a patient that just had her 3-month checkup, Linda Loggins, and she came in originally for knee pain. Linda, can you tell me a little bit about the pain that you experienced before you had your stem cell injection?
Well, I couldn't walk. I would use a cane. The pain was over the scale of a 10, and I probably should have used a walker, but I just wouldn't. Yeah. So trying to work and walk was very difficult.
Okay, and what would you say that the pain scale is now?
Below a 5.
That's awesome. Can you stand up and show us and bend your knee?
Absolutely.
I think that's more important to anybody.
Now, before I had the stem cell, I could get my foot about that far up in the back. I could not bring it any further because of the pain. I can, any of that now.
That is
I could
great.
not do that before.
Well, awesome. Would you recommend someone else that has knee pain to at least look into this as a therapy before surgery?
Absolutely. I mean, it was so quick and easy. They gave me the injection and I was a little shocked that, okay, that's it. Go home now. And I didn't even miss out of work that day. I went straight back to work after the injection. And then there's been nothing except the 3-month doctor appointment, and I'm able to walk and move now where I couldn't before.
I'm so happy for you. Now, how long did the injection take? Because people don't know that we don't do the adult stem cell where they're taking the bone marrow out. It literally is less than 10 minutes, and most people don't even believe. They go, can it be that fast? But it is, isn't it?
Oh, absolutely, it's that fast. There was nothing. I mean, it was just...
So no downtime.
No downtime whatsoever.
I'm very, very happy for you. And remember, we still have all that other time left for it to continue to grow and get better. So I'm very happy for you.
Thank you so much.
All right.
I was in a lot of pain, walking less and less, not going up and down stairs. I have to go up 4 stairs to get into my house, no matter which way I go. It's very painful. I had fallen a time or two. It would give out. Stopped walking the dogs. My husband had to do that all the time, not me. It was really affecting me. it's a whole lot better. I'm getting around, I'm starting to do more housework and all of that. Still don't like steps real well, but it's getting better. I just was given a brochure with more exercises I can do to strengthen my leg because it got weak from not using it too much. So it's much better. It took 2 weeks, and on the day of the second week, it was like, boom, I got up. Oh, it feels a lot better. I was a little bit afraid, not that I'm needle shy, because I'm not, and I'd had cortisone shots and they didn't do anything. But I just thought that this is different. I didn't know what to expect. There was a man here named Oliver that did the procedure. He numbed it with very small needles, and other than the needle that the stem cell stuff is in, is big. So I did feel it go in, but it wasn't as bad as cortisone shots, in my opinion. I only had one little tiny bruised place. So, I mean, I was very pleased because I was leery. Thought, oh dear. I would, most definitely. I told the doctor earlier, it's the best money I've spent, and I don't have money to spend like that. I just don't. None of us do, or there's a few that do, but there's a lot of us that don't, and I feel like it's the best money I've spent. And I'm just so grateful that I did pick this up on Facebook and have the courage to go to this seminar. I'm like, this may be some fly-by-night thing. No, it's not. It works. And I'm just looking forward to those stem cells just keep doing their thing, and I can get rid of the brace one day and all will be well.
All right, so I'm Debbie, and I'm here with Linda, who had the amniotic tissue matrix injection to the low back a week and a half ago. Mm-hmm. So Linda, what condition did you get the amniotic tissue matrix injection for?
My low back.
And how long had you been suffering with that condition?
25 years.
And how does it feel since you had your injection 10 days ago?
Remarkable.
Nice. So can you elaborate on that a little?
I have absolutely zero pain, no stiffness, no muscle pain in that area.
And it had been bothering you for 25 years?
Yes.
So we just had Easter. You do big
Yes,
holiday
I did
dinners.
the
How
holiday
did you get
dinner.
through that?
I was on my feet for probably 2 days, for probably 15 hours each day, and didn't have to sit down, didn't have to take a break, didn't have to take any aspirin, nothing.
No, great. Would you recommend this procedure to others?
Oh my God, yes.
And did the amniotic tissue injection hurt?
Just very momentarily.
Okay. And what made you decide to do the procedure?
I didn't, surgery is not an option, wasn't optional for me. And I had to do something to try to prevent going on narcotics or anything to reduce the inflammation and pain.
Okay. Would you like to help others experience the same result?
Yeah, absolutely.
Great. All right, Linda, thank you very much.
You're welcome.
We're just gonna let people know how awesome your stem cell therapy works. So this is Annette's pre and post from January to now, and you can see it's significantly different. So Annette, why did you first get stem cell therapy? What were your symptoms?
Well, my knee was hurting.
Okay, and then we did the stem cell therapy. How long did it take for you to get the injection?
Not very long.
Less than 15 minutes, right?
Oh, yes, yes.
So did the procedure hurt?
They put, the pain stuff there too, so I wouldn't feel
Yeah.
that. But no, nothing, no big thing,
No pain, right?
no.
And then after the injection, were you able to go do whatever you wanted to do? Or
Yes, I did follow all the orders that were given to me on what I was allowed to do or what I was allowed to take as far as medicine, and I followed the directions explicitly.
okay. Now, if someone else was having knee pain like this or problems, would you recommend that service to
Oh
them?
yes, because I was looking to a knee operation and I just couldn't go through it now and do all that rehab.
So there's definitely no need for a knee operation now.
No.
That I am so happy for you.
I am too. Thank you.
You're welcome. Hello, Lori.
Hi, how are you?
I'm interviewing a patient that had stem cell injections into her knees. I want to go over, Lori, why is it that you first came in to even look at that as an option?
I played tennis for 35 years. My knees started getting really bad in my late 40s, early 50s. I was at the point I couldn't hardly walk up and down stairs. I would have to put one foot on one stair and then the same foot on it and kind of look like a little old lady going up and down stairs. Coming upstairs was horrible. What really motivated me to do something about it, which is a sad thing, is I was introduced to a game called pickleball in the spring of 2015 and started playing it seriously in the summer. And my knees were hurting really bad. So I heard about your company and researched it some and came in for a consultation. And after hearing where the cartilage comes from and it all made sense, common sense, I went for it. I went for both knees January 7th, 2016.
How long did
Almost
it?
6 months ago, 7 months ago today almost.
How long did it take before you noticed the difference?
Probably 6 to 8 weeks. What y'all didn't know when I first had it done is I wasn't playing pickleball much because it was winter and we were kicked out of the gym for basketball. But as of February, we picked up 6 days a week, playing almost 30 hours a week. I
Are
also
you playing
teach it.
6 days a week now
Yes,
with those new knees?
yes.
Could you have done that
Well,
before?
y'all told me to stay off of them for 3 days, and that
Okay.
was hard, but I did. I didn't do anything on them for 3 days.
So how
And then
often do you play now?
6 days a week, sometimes 7. I also teach it, and so some days as much as 5 or 6 hours a day. Today will be 5 hours, so I'll be playing 3
And
hours
what-
this morning and 3 tonight.
So what is the level of pain that you have now?
No pain, no pain. The only thing left, I'm taking stairs up and down, no problems. The only thing left at the moment is I'm playing so much that, pounding them still, that I have a little bit of inflammation sometimes. And so when I quit, I'm feeling good. And if I go out to eat afterwards in a cold restaurant and I get up, I'm a little stiff. No pain. It's just, it takes
Awesome.
me a minute to...
Well, let's show everybody your film pre and post. So if I look at it, the left side is today, the cartilage now, and the right side is what it was before we started. And I want you to notice how big of a difference the margins are, and the black space, that is the cartilage changed. And that's visible on x-ray. It's the same x-ray machine in place, so it's unbelievable. So Lori, the last thing that I have to ask you is, would you recommend this to other people that have knee problems, or would you tell them just go have surgery?
That's an obvious answer. I mean, y'all were really good about saying it's not for everybody, so you got to come in for a consult so we can actually take x-rays and see if this will work for you. But absolutely, if you say this is something you should try, I would highly recommend you, and well worth it. If y'all say it works, I trust y'all that it would probably work for you.
Thank you for the vote of confidence. I appreciate it.
You're welcome.
All right, I've got somebody very special for you to meet now. His name is Jerry Jarity. Welcome to the show.
Thank you.
Now let me start with, how old are you?
80.
80 years young.
Just turned 80.
All right, now you were in pain, weren't you?
Yes.
What part of your body?
Lower back.
And what happened?
It just went. It just started for no reason. I didn't hurt it. It just happened.
Now, have you been healthy most of your life?
Oh yes, yeah. I've had some surgeries, but not a debilitating thing.
And you didn't do anything specific to your back?
No.
Really? So tell me what happened. How did you?
Well, I just woke up in the morning and it was hurting. Next morning I woke up, I could hardly move.
On a scale of 1 to 10, how severe was the pain?
Oh God. Hardly moved. It had to be like 9 or 10. It was hurting.
Okay, and so what were the first treatments that you sought out?
Well, I went to my doctor and he recommended a chiropractor. I went there and had some treatments, and he told me, I don't think I can do any more for you than what I have done up to this point, which was maybe 3 or 4 treatments.
And so let me ask you, do they also prescribe pain medication to kind of just dull the pain?
You know, I don't recall if he did or not.
So then you said, is there another way? And what did you discover?
He said, try a pain doctor.
Okay.
So I went and seen him, and I had some shots in the back. I don't know how many times, a number of times.
Right.
And they did the decompression apparatus on me.
Right.
And that helped, but it only would help for maybe a week, you know, and then I'd be back to the same pain.
So what did this pain keep you from doing?
Well, I didn't golf that year at all, and I don't know if I golfed the next year. And
Really?
I enjoy golfing, you know, I just couldn't do it.
Well, because you're retired and that's what you want to enjoy your life, and now you're stuck in pain.
Yes.
So how did you find the stem cell therapy?
Through an ad in a local paper. They have a magazine that comes out, and inside they put in flyers.
Right.
And I saw the flyer probably 3 times, and I kept telling my wife, Sally, I said, I should do this. And it took about 3 times before I called. And
Well, what intrigued you about doing it just from the ad?
getting rid of the pain.
Yeah?
And being able to do something, you know, do things I want to do, not just sit around and feel sorry for myself.
So describe your experience.
Well, I went to the seminar, talked to Dr. Howe, and she recommended coming in and have this done. And from what I remember or understand, I was the first one to have the treatment
Wow.
on my back.
Now, bring me back to the seminar. So you're sitting in there and you're hearing, and what was with promise at the seminar that got you excited?
Listening to what other people had done to their knees or ankles or hips or whatever, and how much better they were, how much better they felt.
Right.
So, well, okay, let's try this. So we did.
All
I
right.
did.
And what was the experience of doing it?
As I'm having it done?
Yeah, let's start there.
Okay.
So you went into the office and you met with them, and what happened? What was it like?
It was enlightening. I didn't think anything like that could be done for me. You know,
Really?
I thought I was in pain, and this is it. You know, because I think back of my dad being in pain all his life, and he talked about doing himself in. He just couldn't take the pain anymore. And it's scary. It's scary. I felt the same way, you know. And
No, I don't know. So what happens? You're in that much pain, and how did you feel?
tired, mentally tired. It just wore me out, the pain, you know.
And it's interesting because my dad also had a severe back pain, and there was nothing they could do back then.
No, there wasn't. Finally, they did something for him, but it wasn't totally a good thing. Where I believe that my back hurting is gone.
So let me ask you a question. Let's take you back for a second. If you could talk to your dad right now and tell him there is something now, what would you say to him?
Oh, get it done. No, do it. It's something that if somebody has a pain like that, take care of it. It helps.
Okay, so they did the procedure, and how did you feel?
After the procedure?
Yeah.
I just felt, I can't explain that. I just felt like something's going to be good.
Right.
Something's good is going to happen from this procedure.
How long after you had it done before you start to feel good again?
Oh, before you mean the pain?
Yeah, like the pain was gone.
It was, I'd say about a month, 6 weeks, something like that.
And so you woke up one day, and how does that feel to be pain-free?
Well, it wasn't a pain-free. It was still a gradual thing.
Right.
It just happened gradual. And, but, you know, I told my wife, I said, I think things are going to be good.
Right.
And that went on for maybe 6 months, and it felt real good. Then I would say maybe a month ago, it's just like the pain was gone. You know, I don't have that pain.
Now, wait a second. This is one treatment you had?
Yes.
And in how long a period of time? Your pain went from a 9 to a...
I'd say 1 at the most.
Oh, my gosh.
Yeah, it just, there's nothing there. The back gets tired.
Right.
But that's, I think, due to other things, not the problem I had.
So now, how did your quality of life improve?
I guess I can't explain that. The quality of life, it has always been good.
Right.
I have a nice wife.
Yeah.
You know, she takes care of me. She does things. We do things for each other.
Right.
And I have I think, a good outlook on life. And things are going to get better, I always feel.
Right.
And
so when you were back in pain, go back to before you had this procedure.
Mm-hmm.
You talk about your wife. Did your being in pain affect your relationship with your wife?
Oh, yes.
How?
I think I was short with her, you know, and it just wasn't a good feeling. It wasn't like it was before I got hurt. You know, we used to do things together.
Right. What were some of your favorite things to do together that you couldn't do anymore because you hurt so much?
Just going out and sitting in a restaurant and having dinner.
Right.
You know, it just wouldn't work. Where we lived at the time it happened, we played cards with the neighbors.
Right.
Once a month, I think it was. And it bothered, it hurt to sit there in a chair and play cards. And it wasn't real enjoyable. I would have to get up and, you know, walk around a chair a few times to make it feel relieved.
All right, so there's somebody out there listening to this who's currently in pain. What would you recommend to them?
I would recommend them getting someone with this, get a hold of someone with the Stem Cell Institute of America and finding out what can be done for them. And I think they'll find out that something positive can be done.
Right. So Jerry, I understand that you've recommended this procedure to other people. What have you said?
I've said that I have been pain-free and talked to them. I said, I'm not saying do it, but talk to them to see if you want to have it done. And apparently they have. I got a call from a lady that I don't know, and we talked for a half an hour about the procedure. I don't know what she's going to do, but I was very positive with her.
Right.
And I told her that you have to want to do it. You can't just do it because somebody says so.
Right. So you're telling me that one treatment at the Stem Cell Institute of America left you virtually pain-free?
Yes, yes.
You do know that sounds almost too good to be true, right?
Yeah.
No, seriously, it does.
Yes, but I am. Like I said, I do have the tired feeling in my back,
right.
But I don't have the pain.
So this is like giving up. I'm sorry, I'm looking at you at 80 going, you've got another 20 years to keep going. How much more exciting is it to be pain-free versus being in pain for that time?
Oh, very much so. Very much so. It just really helps. It helps the mind. It just helps. But there's always something else that could go wrong.
Oh, stop being pessimistic. What are you looking forward to doing most with your wife now that you're virtually pain-free?
Just getting out more, doing things. We're satisfied with staying home.
Yeah.
But there's things to do. You know, nothing specific.
Take me back to your dad for a second. It bothered me. What did your dad do for a living?
He was a laborer.
Okay, so my dad was a machinist.
Yeah.
So what did being in pain do to him?
Well, he didn't have the pain until he retired.
Oh, really?
Yeah. He didn't.
That's supposed to be your good life, by the way.
Yes, but I think he was maybe he had to retire at 65. You know, you have to get out of work. They had all kinds of rules back then, and I would say it was probably 2 or 3 years later it started.
Did you watch him suffer?
Yes, I watched him suffer. He would have ice packs made for his leg because he thought that was his leg that was hurting.
Right.
And he had 2 of them. One would be in a freezer, one would be in his leg.
Oh, wow.
And that would just more or less numbing the leg, you know, with the ice.
How
pack.
bad did it get for him?
He couldn't sleep nights. He just couldn't sleep. He might catch a few minutes of sleep. He'd wake up and he'd sit on the edge of the bed. And this went on every night. And then he felt when he would sleep at night, he had to be in his own bed to sleep.
Let me ask a question. When you were in pain, did you think about how much you watched him being in pain, going, maybe this is the rest of my life?
The pain my dad had, I thought was going to be what I was going to have. And it was. You know, when it first started, I said, oh my God, I'm starting over for my dad, you know? It's just continuing on. But having this treatment did do its job.
Yeah?
It helped a lot.
Nice. Anything else that you want to say about it?
No, I'm thinking about having some other things treated with stem cell.
Yeah.
We'll see how that goes. And I'm sure what I'm going to have done is going to help my body more than just what I had done with the back.
Why?
Because I feel that I'm limping and it's hindering the back. You know, that's where my soreness is coming from, I feel. And if I have this treatment done on my knee and ankle, I probably won't be limping anymore. I'll be walking with a straight walk.
What is your understanding of what stem cell treatment is?
Oh gosh, it's a miracle. I don't know. I just know it works. I don't know why. I can't tell you why.
But it worked. So Jerry, tell me, the entire procedure that you had at the Stem Cell Institute of America, how long did it take?
The preparation for it, getting on a table and so forth, and setting up all the equipment took the time. The shot was probably 5 minutes.
So wait a second. Now you've had surgeries for pain too, haven't you?
Yes.
That wasn't 5 minutes.
No, it was not 5 minutes.
So what you're telling me that a 5-minute procedure has left you virtually pain-free?
Yes, yes.
You know that sounds a little too good to be true, right?
Well, it's true. It happened. It happened to me. I know how I feel and what it did.
So Jerry, I want to thank you so very much for sharing your story. You know, you've inspired so many people, and for those of us who do suffer in pain, this is really very exciting, isn't it?
Yes, yes.
All right, well, thank you very much, and I invite you guys to stay tuned because we're going to learn a lot more about stem cell therapy when we come right back.